Hey guys, hello, good afternoon, or good day to all of you. I'm Joseph, a licensed teacher by profession, and I'm a student nurse as well. And this is my own notes about von Willebrand disease, and this is my first time doing med-surg stuff. It's from my series called the Coagulation Disorder Series Part 1, and it's made by me. Okay? Yeah, for a while. Your von Willebrand disease, by the way, it's the most common inherited bleeding disorder that's characterized by quantitative or qualitative dysfunction of your von Willebrand factor, and it's a lifelong condition that's more common in biological females, and it's caused by mutations in the von Willebrand factor gene in your chromosome 12 that causes the disease, okay? And people with this disease may experience ecchymosis or easy bruising, frequent or hard to stop nosebleeds or epistaxis, heavy or prolonged menstrual bleeding or your menorrhagia, or excessive bleeding after injury, surgery, dental work, or childbirth, okay? And yeah, in severe cases, bleeding may occur after minor trauma or without an obvious case. And some people may have gastrointestinal bleeding or your hemarthrosis or your bleeding into joints, okay? And symptoms are more noticeable in women because of bleeding, increased bleeding during menstrual periods or after childbirth, okay? But before that, what's your von Willebrand factor? It's a glycoprotein that's crucial in your primary and secondary hemostasis, and those are stored in your ribopalade bodies. Those are specialized organelles that store and release your von Willebrand factor, okay? And ang second nito would be your megakaryocytes or yung parents ng ating platelets, di ba? Yung sa ating hematopoiesis, okay? Yep. Those are stored in the alpha granules in your platelets, and those are released upon activation. And also, your von Willebrand factor is an acute phase reactant, therefore your levels temporarily increase during your pregnancy, stress, or infection. Okay? May dalawang functions po tayo for the von Willebrand factor. Okay? First is sa primary hemostasis na tayo or sa platelet plug formation, di ba? Ganito siya. During your primary hemostasis, vascular injury exposes your von Willebrand factor bound to subendothelial collagen and your glycoprotein 1b receptors on your surface of your nearby platelets adhere to exposed von Willebrand factor. Therefore, it triggers platelet activation and it initiates cascade of events which entails the release of von Willebrand factor from your alpha granules and recruits more platelets to form a plug at the site of damaged endothelium. Okay? And pangalawang function natin is sa secondary hemostasis or your what we call your coagulation or clotting cascade. Doon na siya. Kasi nga, nangyayari si factor 8 sa intrinsic kasi nandoon siya. Your factor 8 binds to your, or shall we say, your von Willebrand factor binds to your factor 8 para continuation ng cascade, okay? So your plasma von Willebrand factor supports intrinsic coagulation cascade by stabilizing your factor 8. Therefore, tataas ang half-life. Okay? During the intrinsic coagulation pathway, your thrombin will cleave binding site with your von Willebrand factor to make it the activated factor 8, and clotting process will continue as what I've told you earlier. And usually, your von Willebrand factor is a chaperone or a carrier for your factor 8. It influences common coagulation pathway and generation of thrombin and fibrin. Okay? That would be very much it. And sa cellular level natin, okay, nag-cellular tayo, nag-biochem tayo dito, ha? So yeah, your von Willebrand factor, it's from a gene that expresses and encodes from your chromosome 12, and it's a 2,913 amino acid pre-pro polypeptide of repeating domain sequences, and ang first 22 natin, pasensya sa manok, char lang. Yeah, yung first 22 natin, that's your SP or your signal peptide that initiates your post-translational processing. And that SP is being cleaved to allow propeptide monomers to dimerize. Okay? And it's rich in cysteine that facilitates multimerization and disulfide bridging. And yeah, it combines different amounts of pro-von Willebrand factor subunits, and result, it's a mix of multimers ranging from 2 to 60 pro-von Willebrand factor subunits. Okay? And once assembled, the propeptide domains essential to aligning pro-von Willebrand factor domains are cleaved to form the mature 2050 amino acid von Willebrand factor, and once complete, transported na siya for storage in the alpha granules of megakaryocytes and packaged into your ribopalate bodies within your endothelial cells. Okay, yung von Willebrand factor gene natin, ang location niya, it's from the chromosome 12, it's from the short RMT, that's the specific location, and it spans approximately 178 kilobase. Okay, and some things about the epidemiology. It's detected more often in women, and it affects up to 1% of the general population. It may be severe in people with type O blood. Ma-discuss ko yan quite a bit later. But here, guys, ang tasang history nitong von Willebrand disease, guys. It's from, or shall we say, it's named after Finnish physician Erik Adolf von Willebrand. Okay? Kasi usually ang diseases, guys, kung hindi siya name after the proponent or the one who discovered the disease, it may be a scientist, it may be a doctor, it may be rin from the patient, guys, from the patient who is the index case or yung first patient ng ating disease. Like your hemophilia B or what yung tinatawag natin na Christmas disease. It's not Christmas na Christmas, ha? It's not Christmas na celebration, but it's from a boy named Stephen Christmas. Doon siya pinangalan. Okay? So in 1924, he investigated a large family suffering from a bleeding disorder that seemed to differ from hemophilia, and he was called to the Aland Islands to treat a 5-year-old girl named Hjordis who suffered from severe life-threatening mucosal bleeding. That's a condition that had already claimed the lives of 4 of her siblings. And symptoms look like hemophilia, but mali ang clinical finding. Bakit, guys? Ang hemophilia A natin, or shall we say, yung lahat ng variants ng hemophilia, or not all brands ng hemophilia, kumbaga. Yung hemophilia A natin, hemophilia B, or hemophilia in general, guys, X-linked disorder. Bakit X-linked disorder? It affects males. Yung von Willebrand disease natin, it affects both genders. Okay? Yung bleeding natin, it's from the nose, gums, and skin. Nakita niya yan sa bata na yun. Okay? That's what you call the mucocutaneous bleeding and bleeding time prolonged. Okay? He spent years mapping the family tree from the Aland Islanders and identified 23 out of 66 affected people. And in 1926, he published the first manuscript in Swedish, and he named it Hereditary Pseudo-hemophilia, or in English, Hereditary Pseudo-hemophilia. Okay? And in 1931, he also published a German language version, and blood samples were sent to researchers at Johns Hopkins Hospital in Baltimore, Maryland, and with the help of this person, Jurgens. And Jurgens called von Willebrand and conducted studies, and they co-authored an account on the disease, and they renamed it Constitutional Thrombopathy. Okay? And yeah, it became eponymously as von Willebrand disease. Okay? And yeah, in 1970s, guys, the discovery of Ristocetin allowed doctors to measure the von Willebrand factor activity in lab testing, and Ristocetin was identified to induce platelet aggregation. Ristocetin, that's originally an antibiotic from the soil bacterium Mycotopsis cereida, and its launched in 1957 as a potent antibiotic against gram-positive bacteria, including a resistant staphylococci. And yung mechanism of action nito, it binds to von Willebrand factor that makes it changes its shape. Okay, so that it gives platelets and pulls together into clumps inside the general circulation, but na-withdraw siya from the clinical practice in the late 1950s due to hematologic toxicity. And ang side effect natin, walang iba kundi ang drug-induced thrombocytopenia or your low platelet levels. Okay? And yung bata na sinasabi ko kanina, guys, si Hjordis or si Hjordis. Correct me if my pronunciation is wrong about that name. Okay? Si Hjordis or Hjordis, I would like to call her Hjordis. She was the 9th of 11 children, in which 3 of her siblings bled to death. And she was regarded as the index case, the first patient, okay? And her parents, Oscar and Gusta, any clinical presentation, epistaxis, the mucocutaneous bleeding, the gingival bleeding, and the hematomas, okay? And in 1924, Hjordis was brought to Diakoness Hospital in Helsinki, and Dr. von Willebrand himself noticed differences between her condition and hemophilia A. Kasi nga sa hemophilia A, as what I've told you earlier, X-linked disorder sa hemophilia A, which affects exclusively almost all males, okay? And her condition affects both males and females, and prolonged skin bleeding time, okay? And she died in 1932 during her 4th menstrual period at the age of 14. Ang bata pa. Yun siya. And the chemical composition of your von Willebrand factor, these are the domains, and this is the sequence, guys, from the N terminus down to the C terminus, okay? So yeah, your NH2, that's the very first part, that's the amino, okay? The SP, as what I've told you earlier, the signal peptide that initiates post-translational processing, okay? Your D1 and D2, that's your propeptide, that's the for the multimerization of the protein and the proper folding, and it's cleaved by the enzyme furin after secretion. And dito sa D to D3, that contains a binding site for factor 8 and it protects from premature degradation by your activated protein C. Therefore, if masisira or madadamage itong dalawang domains na ito, type 2N tayo, which signifies the normal von Willebrand factor and very low ang ating factor 8, okay? Ang A1 natin is responsible for binding for the platelet receptor, glycoprotein 1B, and your heparin and your subendothelial collagen, and your beta-2 integrin receptors on your leukocytes. Therefore, yung mga diseases or types ng von Willebrand factor that affects that domain is the type 2B or your gain of function, and your 2M, which is your loss of function, okay? Gain of function si type 2B because your A1 domain too sticky and binds to the platelets in the bloodstream rather than waiting for an injury. Di ba dapat ang mga platelets mag-bind siya doon sa injury site? Pero yung platelets natin, kasi nga damage sa A1 domain, doon siya sa bloodstream. No, oh. And your platelet, von Willebrand factor clumps, that's cleared by your spleen, therefore thrombocytopenia or low platelet levels sa'yo. Okay? And your type 2M, that's your loss of function. Yeah. Your von Willebrand factor levels normal, pero your platelets or your protein cannot grab the platelets. Therefore, severe bleeding siya kasi nga walang magproprotect. Oo. And walang magbabinds. Okay, okay. And yeah, your A2, that's acts as a mechanosensor, and your switch unfolds when exposed to high shear stress to expose other von Willebrand factor domains and contains a cleavage site for your metalloprotease ADAMTS13. Yeah. Okay, ADAMTS13, I will explain to it to all of you quite a bit later. And yeah, type 2A, that makes your A2 more unstable or easier to unfold. Therefore, ADAMTS13 cleaves the von Willebrand factor molecules too early. Therefore, pag na-cleave natin ni ADAMTS13 si von Willebrand factor, wala tayong multimers kasi nga inunahan na niya. Oo. Okay? Ang cleavage site natin, by the way, is from the tyrosine 1605 to methionine 1606 bond. Okay? So yeah, your A3, that's your primary binding site for collagen in damaged vessel walls, and mutations result in a von Willebrand factor molecule that can bind to platelets but cannot anchor itself to the wound site. Okay? So yeah, your D4, it's involved in the structural assembly and the multimerization of the protein. And your C1 to C6, that's a series of small C-type domains formerly grouped as a single BC region and facilitates platelet integrin binding to your alpha-2B, B3, or beta-3 by the RGD or your arginine glycine aspartic acid motif. Okay? Your cysteine knot, that's responsible for the initial dimerization of your von Willebrand factor subunits in the endoplasmic reticulum. Therefore, mutations ating cysteine knot domain prevent the very first step of von Willebrand assembly in the endoplasmic reticulum. Okay, therefore type 1 siya. Okay, because your cells destroyed malformed proteins before they are released or your proteolysis. Okay, and yung COOH or your C terminus, which is your carboxyl group, that completes your sequence sa ating chemical composition ng von Willebrand factor. Okay, normal muna tayo before the abnormal. Okay. So your pathophysiology, I've made quite a bit of a legend here. Okay, yan. So, PX for the patients and SX for the symptoms. I've made that, okay? And, pag red, direct involvement. Pag orange, indirect involvement. Ganito siya, guys. Sa ating precipitating factors, unahin muna lang natin ito. Ang precipitating factors natin is physical trauma, surgical and dental procedures, menstruation, and your platelet inhibiting medications like your NSAIDs or your non-steroidal anti-inflammatory drugs, okay? Your aspirin and your ibuprofen, your diclofenac, your ketorolac, your naproxen, those are some, okay? So, before the progression, mamaya na tayo dyan, the predisposing tayo, okay? First, predisposing factor would be your genetic inheritance patterns. It's divided into two, okay? Your autosomal dominant and autosomal recessive. Autosomal dominant, a person needs one mutated allele to inherit the condition. Therefore, types 1, 2A, 2B, 2M, and your platelet type or pseudo-von Willebrand disease. And your autosomal recessive, a person needs two mutated alleles, one from each patient to inherit the condition, which is 2N and yung 3. Take note, ang 3 is the most severe type of your von Willebrand disease. Okay? Second would be the ABO blood types. Kasi nga, ang type AB and AG, may A and B antigen siya attached to your von Willebrand factor, okay? And yung type O natin, since baba ang von Willebrand factor levels, it also lacks your A and B antigen. Meron lang siya H antigen na lang, okay? And your ADAMTS13, which stands for, a disintegrin in metalloprotease with the thrombospondin type 1 motif number 13, or your von Willebrand factor clearing protease. That's a key regulator of blood clotting by cleaving von Willebrand factor, and it prevents excessive platelet aggregation. Therefore, pag faulty si ADAMTS13 natin, TTP, or your thrombotic thrombocytopenic purpura due to hereditary mutations or your autoantibodies. Therefore, si type O blood, since baba na yung von Willebrand factor levels niya and wala tayong A and B antigens, it leaves your von Willebrand factor molecule open. Nakikita siya na ADAMTS13, i-cleave siya into small pieces, and therefore those small pieces are being cleared from the circulation by your liver and your spleen. Okay? Balik tayo dito sa progression and mechanism natin. So your precipitating factors and your predisposing factors contribute to your progression mechanism. Your von Willebrand disease, guys, it primarily affects the primary hemostasis. Mamaya na si secondary, mamaya naman na yan. Okay? Si primary hemostasis, the normal physiology natin, guys, your von Willebrand factor binds to subendothelial collagen and your glycoprotein 1B complex receptor on platelets. If hindi siya magbabind, weak or unstable ang ating platelet plug, ang manifestations natin ito is mucosal bleeding, easy bruising, and bleed longer ng ating minor cuts. Okay? Si secondary hemostasis, indirect lang siya ha, indirect lang. Your normal physiology sa secondary hemostasis, yung von Willebrand factor natin, it binds and stabilizes your factor 8. Okay, if not, it's rapidly degraded by your activated protein C, and ang progression natin, bababa ang factor 8 levels natin. Sluggish or slow ang ating intrinsic pathway, and your fibrin mesh or fibrin mesh that's produced too slowly. Therefore, von Willebrand disease na siya. Okay, there are 5 types of your von Willebrand disease. Yan, to zoom out that. Itong 5 to. Okay? Your 5 types of von Willebrand disease is your type 1, type 2, type 3 acquired, and your pseudo von Willebrand disease. Okay? So, for your type 1, that's the mildest one. It's the most common. Pero sa type 1, von Willebrand factor works properly but you don't have enough in the bloodstream. Therefore, it is quantitative. Okay? Therefore, pag kulang si von Willebrand factor sa bloodstream, it challenges clotting activity, therefore tataas si risk of bleeding. Therefore, bababa si levels ng factor 8, and bababa rin si von Willebrand factor concentration and activity. Less than 30 IU per deciliter. Okay? And it's autosomal dominant. Nasabi ko na yung kanina. And ang symptoms natin, it's mucocutaneous bleeding exacerbated by your NSAIDs, and gingival bleeding, and menorrhagia, and post-procedure bleeding. Okay? And for your type 2 von Willebrand disease, that's the moderate type. It's autosomal dominant and also autosomal recessive. It depends on the type. Okay? Autosomal dominant 2A2B2M, and the autosomal recessive is 2N. Qualitative siya, guys. Normal ang amount natin ng von Willebrand factor, okay lang siya. Pero yung von Willebrand factor, pangit ang quality, misshapen or dysfunctional. Therefore, hindi siya function properly. Oo. So your normal physiology, your von Willebrand factor has multimers that bind to platelets and your factor 8. And if binding doesn't occur, hindi siya makakarry ang ating platelets sa ating injury site para mag-form ng ating platelet plug. And therefore, your factor 8 does not get carried to the injury site to form a fibrin clot kasi nga, i-degrade siya ng activated protein C. Protein C. That would be very much it. Okay? And yeah, I've put here 4 subtypes of your type 2 von Willebrand disease. Your type 2A, your type 2B, your type 2M, and your type 2N, or your Normandy. Your 2A, that's the most common. Therefore, baba si von Willebrand factor platelet binding due to the loss of your high molecular weight von Willebrand factor multimers. Kasi nga, inalis siya ni ADAMTS13 too easily and too soon. Okay? Yung multimers natin, absent or very low due to impaired assembly or susceptibility to your ADAMTS13. Therefore, sa ating mga diagnostic tests, baba si von Willebrand factor antigen and si factor 8C or your procoagulant protein component. Therefore, si Ristocetin-induced factor, baba rin siya relative to your von Willebrand factor antigen. And factor 8 activity, normal or low. And si RIPA or your Ristocetin-induced platelet aggregation, low rin siya. And ang symptoms natin, it's moderate to severe mucocutaneous bleeding. Okay? Yung type 2 B, von Willebrand disease, gain of function siya. Sinabi ko rin kanina ito, abnormal ang A1 domain nating von Willebrand factor, which means that taas ang von Willebrand factor platelet affinity and it binds at the bloodstream rather than at the injury site. Okay? Therefore, increased clearance ng platelets natin and your multimers. Therefore, thrombocytopenia. Okay? Recough activity low, your Ristocetin cofactor, reduce or absent si multimers from the circulation, and we are unable to use Desmopressin kasi nga pag gagamitin natin platelet coagulation and your thrombocytopenia pa rin. Okay? Yung symptoms, it's often accompanied by your thrombocytopenia and yung moderate to severe mucocutaneous bleeding natin. And take note, platelet counts drop further during periods of stress, pregnancy, or infection. Okay? Yung type 2M von Willebrand disease, M stands for the multimers. Loss of function, damage ang A1 domain natin. Therefore, may right amount tayo ng multimers. Pero yung factor natin that's not able to bind to platelets. Therefore, wala tayong platelet plug. Kasi nga, your von Willebrand factor simply circulates. Wala siyang ibabind. Kasi nga, yun. And yung factor 8 activity, normal or low. And your RIPA, still low pa rin. Okay? Ang symptoms natin, your moderate mucocutaneous bleeding, your epistaxis, your menorrhagia, and your ecchymosis. Okay? Yung lab findings natin, very low Ristocetin cofactor despite a normal multimer pattern on your electrophoresis. Okay? And your type 2N or your Normandy. Bakit siya Normandy? Hindi siya yung singer, guys. This was the first described in patients from the Normandy region in France. And misshapen or damage ang ating D and D3 domains. Therefore, your von Willebrand factor works normally but it's not able to bind to factor 8 and carry into the site of injury. Therefore, directly proportional siya, guys. Pag baba si von Willebrand factor, baba rin si factor 8. And your factor 8 left unprotected and destroyed quickly by your activated protein C and it mimics hemophilia A. Okay? Ganito siya. Your RIPA and your multimers, normal. Ganito siya, may subtle differentiation siya when it comes to type 2N and hemophilia A. Your type 2N is yellow, hemophilia A is green, okay? Your sa type 2N, your body produces factor 8 but has no von Willebrand factor. Pag sa hemophilia A, hindi siya nag-produce ng factor 8, 9, and 11 much, which stands for hemophilia A, B, and C. Okay? Your symptoms ating type 2N, hematomas, hemarthrosis, post-surgical bleeding. Okay? And since type 2N, von Willebrand factor or von Willebrand disease, by the way, autosomal recessive pa rin siya, it affects both genders. And yung hemophilia, sinabi ko na ito kanina for the third time, it's X-linked. It's almost exclusively affects males. Therefore, ang diagnostic test for your type 2N, very low si factor 8 and factor von Willebrand factor binding or absent. Therefore, baba si factor 8 and si Desmopressin less effective and often requiring von Willebrand factor containing factor 8 concentrates. Okay? And your type 3, that's the most severe type. Bakit, guys? Wala tayong von Willebrand or kung meron, nearly undetectable. Okay? And autosomal recessive, and that accounts to 3.5 or 3 to 5% of those with von Willebrand disease. Autosomal recessive siya, guys. Need ng dalawang alleles to, ha? And they are unable to form platelet plug and fibrin clot. And sabi ko nga kanina, pag wala si von Willebrand factor, wala siya activity kasi nga wala siya. Okay? And RIPA absent or severely low. Therefore, ang symptoms natin, joint or muscle bleeding. And hematomas. Opo. Fourth is your pseudo. Mamaya na tayo sa acquired. Okay, your pseudo or your platelet type von Willebrand disease. Normal si von Willebrand levels. Hindi defective, hindi mutated si gene. Pero ang problema natin dito is the glycoprotein 1B. Oo. The receptors. Yes. Opo. Yes po. Opo. The platelet receptor himself. Okay? Their receptors are too overactive and binds to von Willebrand factor too aggressively and too soon. Therefore, your body removes bound platelet von Willebrand factor molecules. Therefore, baba si platelet count. Baba rin si Willebrand factor multimer levels. Ang symptoms natin, intermittent si thrombocytopenia and moderate to severe bleeding symptoms. Okay? And yeah, your acquired von Willebrand disease, basta acquired, hindi siya po genetic and hindi siya inherited. Okay? And that occurs in individuals over 40 years old with no bleeding history and due to an additional disease that leads to functional impairment of your von Willebrand factor. Okay? Some of the diseases, guys, are lymphoproliferative and hematologic disorders like your monoclonal gammopathy of undetermined significance or MGUS. Therefore, your body produces an abnormal cell production that secretes a monoclonal protein or your M protein. That's usually an immunoglobulin or a light chain. Therefore, your M protein interferes with your von Willebrand factor to your autoantibody formation, your accelerated clearance, and your immune complexes, which are recognized by your Fc receptors and your macrophages, and are rapidly cleared from the circulation. Therefore, baba itong dalawang levels ito. Directly proportional siya dito, okay? And absorption onto malignant cells or your surface level phenomenon. Therefore, your molecules adhere or stick, okay? Your multiple myeloma, which is the more aggressive approach than your MGUS kanina. Okay? It often causes high blood viscosity due to high protein levels and it complicates bleeding symptoms of acquired von Willebrand disease. And yeah, increase ang protein levels natin and yeah, pronounced interference with your von Willebrand factor which lead to mucosal and GI bleeding and prolonged bleeding after minor procedures. Therefore, in patients with your multiple myeloma, baba si Ristocetin cofactor and baba rin si antigen and baba rin si factor 8. Opo. Yeah. And your chronic lymphocytic leukemia and your lymphomas, which is associated by the overproduction of abnormal B lymphocytes which specifically target von Willebrand factor and bind to the A1 domain, it inhibits function. In persons or in people with this kind of disease, baba si Ristocetin cofactor, baba si antigen, shorten ang half-life, and if you give the patient von Willebrand factor concentrates, it disappears from this system in approximately 1 to 2 hours instead of the usual 20 to 24. Okay? Your cardiovascular diseases, your aortic stenosis, or your Hyde syndrome, your high velocity blood flow to a narrowed heart valve, shears and uncoils, von Willebrand factor multimers, and ADAMTS13. Therefore, chronic, recurring GI bleeds. Okay? In patients with that disease, guys, normal ang antigen, pero baba si Ristocetin cofactor. And si prolonged platelet function analyzer, prolonged siya. Okay? Your HOCM or your hypertrophic obstructive cardiomyopathy, which is associated by the pathway. Second, heart muscle creates a physical obstruction in your left ventricular outflow tract. Ang pathophysiology natin dito, as large coil high molecular weight von Willebrand factor multimers pass, mechanical shear forces pull this open and unfold, therefore may expose natin si A2 domain which is then recognized by your ADAMTS and cleave. Okay? Pero normal si antigen dito sa patients with HOCM. And your ventricular assist devices, mechanical pumps used in heart failure patients, destroys the large multimers. Okay? Your myeloproliferative neoplasms. Sorry for that. Okay, neoplasms. Sorry for that. Okay. That one. Okay. Wow. Sorry for that. Okay. Neoplasms or your overproduction of your blood cells. Okay. First is your thrombocytopenia. I've told you earlier, baba si platelet levels. And your polycythemia vera or your polyvera from the JAK2 PV617F mutation drives overproduction of your blood cells. Therefore, it triggers thrombotic complications and the degradation of your von Willebrand factor due to high platelet count. Therefore, taas ang chance nating of bleeding. Okay? Your autoimmune diseases like your SLE or your systemic lupus erythematosus. Yeah. Usually, ang pathophysiology natin, immune-mediated si lupus. Kasi nga, your lupus produce your autoantibodies which is your immunoglobulin G and M which bind to von Willebrand factor and it often mimics types 1 and 2. And in patients with SLE, prolong ang apatsa-patsa. Due to baba si factor 8, baba si antigen, baba si ristocetin cofactor, pero taas si propeptide. Oo. And antigen ratio, okay? Therefore, they are resistant to even standard von Willebrand disease therapy. That is your Desmopressin and your von Willebrand factor concentrates. Therefore, yeah, your hypothyroidism, metabolic siya, okay? And yeah, decrease thyroid hormone levels, decrease in synthesis natin ng von Willebrand factor, okay? That will be very much it po for the types and the subtypes of your von Willebrand disease. Dito na tayo sa diagnosis, guys. Diagnosis po. Opo. Okay? So, your diagnosis, red for the primary, secondary for the, red for the primary, orange for the secondary. Okay? Bakit red si bleeding assessment tools, guys? Ito yung first test, ha? Bleeding assessment test. Standardized questionnaire used to identify a person's bleeding history. And, yeah. It's scored from 0 to 4. Pag 0, wala symptoms, wala ring history of bleeding. Okay? Pag 1, mild symptoms, makaya lang siya. No medical condition. Moderate, it requires doctor's visit. Severe, 3. It requires surgical intervention, cauterization, or blood transfusion. And if sa critical, it requires replacement. Okay? Bleeding time and your clotting time, which is in vivo and in vitro. Ang normal bleeding time natin, 1 to 3. Sa may von Willebrand disease, prolonged. Okay? Clotting time, it measures how long it takes for blood to coagulate in the test tube. Normal is 5 to 15. Therefore, in von Willebrand disease, taas siya. More than 10 minutes. Okay? So, your RIPA, your Ristocetin-induced platelet aggregation, it's an in vitro diagnostic test that evaluates the interaction between your von Willebrand factor and your glycoprotein complex. Therefore, your ristocetin mimics your von Willebrand factor binding to platelets that causes agglutination. Pero if absent siya, guys, or baba ang aggregation, decrease ang aggregation. Ito yun, yung mga sakit na yun. Types 1, 2A, 2M, and 3, and si Bernard-Soulier syndrome. Okay? And increase aggregation, si type 2 and von Willebrand disease. Okay. Your coagulation test, those are secondary because sa secondary siya na hemostasis. Opo, sa coagulation cascade na siya. Yung PTINR, wala siya masyadong effect, guys, kasi sa intrinsic siya. Pero if abnormal siya, it may be from a liver disease, vitamin K deficiency, or a warfarin therapy. Okay? So your PTT or your partial thromboplastin time, it measures the intrinsic pathway. Dito talaga makikita ang ni von Willebrand sa secondary coagulation. Okay, guys? Prolong siya sa taong may von Willebrand disease. If baba si von Willebrand factor, baba rin si factor 8. And unstable ang factor 8 natin. And rapid degradation ng bloodstream. Therefore, slow down ang ating PTT. Okay? Sa types 1, 2A, 2B, 2M, normal si PTT pero baba si von Willebrand. In type 3 and 2N, severely low ang ating von Willebrand factor and unable to bind to factor 8. Therefore, still baba pa rin si factor 8. Therefore, prolonged siya. Opo. Your von Willebrand factor assays that confirms your von Willebrand factor and determine type. Your von Willebrand actinogen that measures the total quantity of von Willebrand factor in the blood. Low pag type 1 to 3, normal pag type 2. Okay? Von Willebrand factor ristocetin or your ristocetin cofactor, poor to false low siya due to genetic variations, guys, and poor sensitivity. Okay, and it uses the antibiotic ristocetin. And yeah, disclaimer, guys, some people, especially of your African descent, have a common variation in your von Willebrand factor protein that makes it ristocetin resistant. And they may have healthy von Willebrand factor but tests show a low result because the drug didn't work, therefore misdiagnosis siya. Okay, your von Willebrand factor 8 binding checks if von Willebrand factor can hold on to your factor 8. If not, type 2N siya, which mimics hemophilia A. And yung von Willebrand factor glycoprotein 1BM, what stands for your mutant, it uses a mutated protein that binds to von Willebrand factor activity. Therefore, mas high ang accuracy natin and yung high ang sensitivity. Okay? And it doesn't need ristocetin and it provides a more stable number. And yung multimer analysis natin, those look at the site of your protein strings and if large multimers are missing, 2A or 2B. Von Willebrand factor genotyping, that's a genetic testing used to distinguish among type 2 variants and its use for prenatal diagnosis. And yung von Willebrand factor collagen binding, it measures how well von Willebrand factor attaches to the exposed collagen of a damaged vessel wall. Okay. Let's move on to the factor 8 and ADAMTS13 assays. Factor 8 assays that determines the secondary. Therefore, it's a secondary diagnostic test of your von Willebrand factor in the clotting cascade. And your ADAMTS13 assays that's used to rule out other conditions, especially your TTP or thrombotic thrombocytopenic purpura that involve von Willebrand factor processing but present very differently from your von Willebrand disease. Yeah, your complete blood count. Platelet count. Yes, primary rin to. Yeah, it measures the number of platelets available to form a plug at an injury site. Therefore, your normal, your 150 to 400,000 platelets per microliter. Pagbaba ng 150, thrombocytopenia. Pagtaas ng 400, thrombocytosis. Pero pag 50,000 below, higher risk of bleeding. Okay. Your mean platelet volume that measures the average size of platelets in the blood. Therefore, the range is 7.5 to 11.5 or 8 to 12 femtoliters. Okay? Pagtaas si mean platelet volume, your bone marrow produces many new platelets, especially after blood loss. That signifies or that precursors, kumbaga. Inflammation and infection, vitamin B12 or folate deficiency, and increased risk of thrombosis. Therefore, if baba, suppress bone marrow function, therefore infection. Okay? Often increase in platelet type kasi nga due to restriction of your larger, younger platelets. Okay, that will be very much it for the diagnosis. Treatment na tayo, guys. Malapit na po. So, your treatment, may 6 akong nilagay dito, guys. Okay? Your Desmopressin, your estrogen-containing oral contraceptives, Antifibrinolytics, your plasma-derived, and your recombinant, von Willebrand factor, and your Fibrin sealants natin. Okay? Your Desmopressin, IUPAC name, it's 1-diamino 8-dearginine vasopressin, guys. Because your Desmopressin, that's the synthetic analog of your vasopressin, created in 1977, used to treat nocturnal polyuria, hemophilia A, diabetes insipidus, yours truly, your von Willebrand disease. Okay? Your mechanism of action, guys, your Desmopressin is a selective vasopressin 2 receptor agonist present throughout collecting ducts and distal convoluted tubules of the kidneys. Therefore, your vasopressin 2 receptor is a GS protein coupled receptor. Okay? When activated, signaling cascade. Yung signaling cascade natin, it increases the CAMP or your cyclic adenosine monophosphate in the renal tubule cells. Therefore, tataas your water permeability, per baba si urine volume, and taas si urine osmolality. Okay? Also, in addition, signaling cascade also induces exocytosis of your factor 8 and your von Willebrand factor from your storage sites, as well as your Weibel palate bodies and your alpha granules. Therefore, your von Willebrand factor functions at the first step in thrombogenesis, which is your bridging factor of glycoprotein 1B factor on platelets due to the subendothelial collagen following tissue injury. Therefore, pag nangyari yan, guys, clotting cascade is facilitated, therefore continuation or continued hemostasis. Okay? Administration, IV, as a subcutaneous injection, intranasal spray, and your sublingual strip or your Desmopressin lyophilizate. Adverse effects, hyponatremia. Kasi nga, guys, your Desmopressin increases your urine concentration, and watch for systemic hyponatremia similar to syndrome of inappropriate vasopressin. Seizures, headaches, tachycardia, and your facial flushing. And contraindications, bawal siya sa may mga renal impairment, guys. Because your renal function decreases with age. Bawal siya sa mga younger patients. It's ineffective to patients with type 3 von Willebrand disease because nga walang von Willebrand factor or nearly undetectable si type T. Yeah, you've patients with thrombotic thrombocytopenic purpura, Bisaya jud ko, no? Yeah. Your patients with hypersensitivity to Desmopressin acetate, and it's ineffective in patients with hemophilia B and severe hemophilia A. Okay, there are no known antidotes to Desmopressin overdose. Yeah, ino-A lang to, guys. So yeah, second would be the estrogen-containing oral contraceptives, those for women with heavy menstrual bleeding, because your estrogen stimulates production of your factor 8 and your von Willebrand factor in the body. Therefore, if taas si estrogen, taas si von Willebrand factor to protect the mother from bleeding during delivery. Therefore, these are your progesterone and estrogen compounds, your creproterone, drospirenone, levonorgestrel, and your ethinyl estradiol. which diminishes the secretion of your follicle-stimulating hormone and your luteinizing hormone from the anterior pituitary, and it stabilizes the endometrial surface of the uterus. Okay? Your antifibrinolytics, those are drugs that help the blood clot die by promoting the breakdown of fibrin. Therefore, may class rin siya, guys. The synthetic lysine analogs. And another term, or shall we say, the definition, the antifibrinolytic amino acid derivatives, those prevent the proteolytic action of your plasmin on your fibrin and your plasmin degradation of your glycoprotein 1b receptors. Okay. Yung mga kilala natin na antifibrinolytics, guys. Your tranexamic acid. That tranexamic acid, or TXA, is 6 to 10 times more potent than your aminocaproic acid. Therefore, stronger binding affinity natin ng lysine binding sites. Therefore, 2 to 3 hours, approximately, half-life. And ang mechanism of action nito, it reversibly inhibits activation of your plasminogen by binding at distinct sites, and it also binds plasminogen to fibrin, induces fibrinolysis, and it occupies the binding sites. Therefore, it stabilizes the clot and it prevents hemorrhage. And it's widely used for heavy menstrual bleeding and trauma, and yung adverse effects natin, hyponatremia associated with IV administration and your GI. And guys, may overdose tayo ng tranexamic acid, which is associated with the gastrointestinal symptoms, hypotension, thromboembolism, visual impairment, rash, and convulsions. Meron din tayong, guys, epsilon aminocaproic acid. That's less potent than tranexamic acid, that also has weaker attachment to plasminogen, and ang half-life natin like approximately 2 hours. It requires more frequent dosing and higher plasma concentrations, guys. And ang acute side effects natin, hypotension pa rin, rash, nausea, vomiting, weakness, retrograde ejaculation, and rhabdomyolysis. Okay? And contraindications natin, bawal siya sa patients with active DIC or your disseminated intravascular coagulation without concurrent heparin. Okay? It causes thrombosis, and bawal din siya sa may mga upper urinary tract bleeding. Okay? Your factor replacement, your plasma-derived, and your recombinant. Your plasma-derived, dalawa ang nandoon. Factor 8 and your von Willebrand factor. Sa recombinant, pure von Willebrand factor lang siya, walang factor 8. Okay? Sa plasma-derived, that is sourced from thousands of human plasma donations, therefore, that contains small tumors of your von Willebrand factor. And in repeated injuries, guys, accumulation of factor 8 in the blood. Pero, if too high ang ating factor 8, increased risk natin of thrombosis. And that's preferred for emergencies or major surgeries where patient's factor 8 is low. Kasi nga, may factor 8 siya dito. Okay? And yung recombinant, guys, only useful when patient already has adequate factor 8 levels but lacks your von Willebrand factor. And it's created in the laboratory using genetically engineered cells since no human blood is used. Therefore, wala tayong risk of your blood-borne pathogen transmission. Okay? And that's preferred for patients who require frequent infusions and your fibrin sealants, your very last treatment. Or your fibrin glues or your fibrin glues. Those are biopolymer surgical tools used to promote hemostasis, seal tissues, and aid in wound healing. And that consists of fibrinogen and your thrombin that mimics the final stages of the natural physiological clotting. Okay? And effects natin, positive. Improve time to hemostasis, reduce blood loss, and reduce complications. Okay? And it's currently used in surgical specialties like your CV or cardiovascular, thoracic, neurosurgery, dental, and plastic or reconstructive. And bawal rin siya ilagay into the blood vessels because clotting in the form of thromboembolism or your DIC or disseminated intravascular coagulation. Therefore, may anaphylaxis pa rin or severe allergic reactions. Okay? Tapos na tayo sa treatment, guys. Sa nursing management na tayo. Let me zoom this out. Yeah. Ang nursing management ko dito, guys, for the von Willebrand disease, guys, I divided that into two. The general and the per type. Okay? General muna tayo. May 4 akong nilagay dito. For the general nursing interventions, acute bleeding management, injury prevention, monitoring and assessment, and your patient's education. Okay? For the acute bleeding management, you have to apply firm direct pressure to accessible bleeding sites, your epistaxis or your lacerations. And for your joint bleeding, follow your RICE protocol: rest, ice, compression, and elevation. And administer Desmopressin is as ordered for your type 1 Willebrand disease. And monitor for fluid retention and your hyponatremia because your Desmopressin is an antidiuretic. Okay? Factor replacements of your von Willebrand factor concentrates for severe bleeding or type 1 von Willebrand disease infusion as prescribed. Tayo dito ha. And administer medications like your Antifibrinolytics to help stabilize your clots. Okay? So yeah, your injury prevention. Avoid medications that inhibit or impair platelet function. Ayun, may list ako dito, nasa baba siya. And you have to recommend acetaminophen or your paracetamol for your pain relief. And encourage the use of soft bristled toothbrushes to prevent mucosal trauma. Kasi nga pag hard bristled, increase ang chance mo na masisira mo yung gums. Oo. Mabableed mo yung gums. Therefore, this is the thing that we want to prevent, mucosal trauma or your mucosal bleeding. Okay. You have to avoid high impact, sorry for that, and your contact sports like your boxing, wrestling, running, anything that is involved with strength. Your von Willebrand disease impairs the body's ability to form stable blood clots, therefore increase your risk of your life-threatening bleeding following injuries, collision, and trauma. Therefore, you have to do this na lang. Lower impact alternatives like your board games and your walking. Opo. Yes po, opo. And there are medications to avoid, guys. Aspirin and your non-steroidal inflammatory drugs, they interfere with your platelet function. Therefore, they disrupt platelet activity. And yeah, they block COX-1 and COX-2 that help produce your thromboxane. Ganito siya. It also reduces protection of your stomach lining, therefore may GI bleeding. And it prevents platelets from sticking together properly, therefore bleeding pa rin. Opo. Yes po, opo. So your anticoagulants, your warfarin that reduces your body's ability to produce vitamin K dependent clotting factors. And your heparin, rivaroxaban, apixaban, and dabigatran. And yung apixaban, narinig ko ito in one of the videos. Ang XA is factor A, ban, therefore it inhibits factor 10A or your activated factor 10A, okay? That prevents clots from forming, therefore hemorrhages tayo. Vitamin E, bawal siya in high doses because it acts as a anticoagulant. Therefore, increase ang risk natin of severe bleeding and intracranial hemorrhage, and it also interferes with vitamin K, therefore bababa natin ang plasma levels ng von Willebrand factor and factor 8 natin. Ang fish oil, that acts as a natural anticoagulant because it contains high amounts of your omega-3 fatty acids like your EHA and DHA, your docosahexaenoic acid na laman natin to. This for intellect and yeah. Okay? Which inhibits platelet aggregation that prolongs your bleeding time. Opo. Your turmeric, your active compound, acts as a blood thinner. And your antidepressants, bawal yun siya, guys, because they reduce serotonin storage in platelets by inhibiting the serotonin transporter, your SERT, or your impairs ability to stick together and form clots. And there's a 36% higher risk of bleeding, especially in the GI tract. That's your fluoxetine, sertraline, escitalopram, paroxetine, fluvoxamine, and vertioxetine. Your antiplatelets, guys, your clopidogrel, that prevents platelets from clumping and forming clots, and ticagrelor, and your prasugrel. Antibiotics, guys, your penicillin, amoxicillin, ciprofloxacin, and your clotrimazole that disrupts your platelet function. Desmopressin, guys, your normal mechanism, di ba? Pwede ito siya sa mild to moderate by stimulating release of your von Willebrand factor from blood vessel walls, pero bawal siya. Not suitable for all people in von Willebrand factor, especially type 2, which causes platelets to be removed from your bloodstream. Therefore, bababa si platelet count natin. Chemotherapy drugs, your methotrexate and your cyclophosphamide, it reduces number of platelets. Opo. Your anticonvulsants that complicates management of your von Willebrand factor disease by triggering or worsening the tendencies. Your valproic acid natin that causes thrombocytopenia. Therefore, bababa ang ating von Willebrand factor and your factor 8 levels. And it induces platelet dysfunction. Therefore, acquired von Willebrand disease siya. Okay? And phenytoin, it may affect clotting factors, ha? Ginkgo biloba, bawal siya, guys. Oo. They are potent antagonists to platelet activating factors, guys. And your ginger, bawal siya, guys. Luya. Oo. Those are natural inhibitors of the enzyme cyclooxygenase, and if COX is inhibited, it prevents synthesis of your TXA2 or your thromboxane A2, which is a vasoconstrictor and platelet activator. Therefore, walang signal ng ating TXA2 signaling, and your body cannot effectively recruit platelets to the injury site. Your garlic, which inhibits platelet aggregation by interfering with binding of your fibrinogen to the glycoprotein 2B3A receptors on the platelet surface, and it also increases fibrinolytic activity. And yung vitamin K natin, or phylloquinone, it's not a primary treatment, guys, kasi kailangan lang siya ng ating factor sa ating coagulation cascade or your secondary hemostasis. Opo. Your people with von Willebrand disease may need to monitor high intakes of vitamin K-rich foods. Yung safer na ipainom natin sa kanila, acetaminophen or paracetamol, because they do not interfere with your normal platelet function and your blood clotting. Pero increase intake or overdose, it may be liver damage. COX-2 inhibitors, your celecoxib. Your coxib. Opo. They don't interfere with platelet aggregation. It's often preferred over your selective NSAIDs, your aspirin, ibuprofen, naproxen, diclofenac, ketorolac, and indomethacin. Okay? Your tramadol and codeine, those are opioid analgesics. Those are used for moderate pain if acetaminophen is insufficient for the tramadol, and it reduces risk of GI bleeds, and it doesn't affect the clotting cascade. For the codeine, it also acts as an opioid analgesic, and it doesn't inhibit COX-1, and it works centrally in the mu-opioid receptors on the brain and your spinal cord to alter the perception of pain. Opo. Yes po. Opo. Okay? For your monitoring and assessment, guys, you have to assess for hidden bleeding sa stool, urine, and menorrhagia for women, and ensure the healthcare team is aware of diagnosis prior to any surgery, dental extraction, or your IM. Bawal rin si IM injections when possible, and use the subcutaneous route. And apply prolonged pressure afterwards. And for patients with head trauma, perform frequent neurological assessments, and before administration, check for hidden NSAIDs. Kasi nga, guys, yung NSAIDs natin, diba, they disrupt platelet function. Opo. For your patient's education, instruct the patient to wear medical alert bracelet and keep a log for all bleeding episodes. And for female patients, guys, discuss the use of your oral contraceptives or your hormonal IUDs to manage heavy menses. And ito na, guys, for the per type nursing interventions, per type nga siya, guys. Opo. For your type 1, you have to administer Desmopressin and monitor for hyponatremia and water intoxication. Therefore, restrict fluid intake for 24 hours post-administration. And for the type 2, your Desmopressin usually ineffective or partially ineffective. It causes thrombocytopenia, which causes abnormal von Willebrand factor to bind to platelets, which then are cleared from the circulation. Ang priority natin, guys, monitor serial complete blood counts or CBCs for failing during treatment, and use concentrates for major bleeding. For your type 3, von Willebrand disease, you have to schedule infusions of your factor 8 and your von Willebrand factor concentrates to prevent spontaneous bleeding. And you have to assess for pain, swelling, and decreased range of motion. And you have to use your RICE protocol, guys. Your rest, ice, compression, elevation. And you have to avoid po IM injections, guys, and use the smallest gauge for your subcutaneous and apply pressure for 5 to 10 minutes. Kasi nga, guys, increased risk of deep tissue bleeding and your hematomas, guys. Opo, bawal siya. For your acquired and your pseudo, assess for the root cause and manage the underlying disease for the acquired. And IVIG, if loss of your von Willebrand factor is caused by antibodies and you're in Hyde syndrome, monitor for GI bleeding. And for the pseudo or your platelet type, since Desmopressin is ineffective, that's similar to type 2B, platelet transfusions may be required. Opo. And monitor for signs of your petechiae and purpura, which signifies low platelet counts. And before I end this video, guys, there are effects of your von Willebrand disease on your body systems. First is your hematologic and your circulatory. Hematologic, guys, is the part of your cardiovascular disease or systems. Sorry for that. Is a part of your cardiovascular system that pertains to blood. Opo. And your circulatory, your vessels. Opo. So your normal physiology ng ating hematologic, guys, when a blood vessel is injured, collagen is exposed. And von Willebrand factor acts as a molecular bridge. And yeah, the mechanism is von Willebrand factor binds to exposed collagen in your glycoprotein 1B complex on your platelet surfaces. Pero pag wala si von Willebrands, they simply roll past the site of injury instead of sticking, and it prevents initial platelet plug formation. Therefore, prolong ang bleeding times. And for the circulatory, guys, your coagulation cascade, normal physiology, your von Willebrand factor binds to factor VIII. Therefore, it protects from rapid degradation by the activated protein C. Pero pag wala si von Willebrand factor, your factor VIII is unprotected. Therefore, sinabi ko kanina, degradation siya ng activated protein C. Opo. And, di-decrease ang half-life from 12 down to 1 to 2. And therefore, bababa si factor VIII. And walang, or shall we say, secondary mesh or your fibrin, fibrin, slow siya. Opo. Your integumentary system, guys, your ecchymosis, bruising, opo. Petechiae, guys, those are tiny circular non-raised red or purple dots which is less than 3 millimeters, and they look like rash, but they are actually pinpoint hemorrhages. And your purpura, those are larger purple spots which ang size niya is around 3 to 10 millimeters. Opo. Your hematomas, your localized collection of your blood outside your blood vessels, and prolonged bleeding from your minor lacerations. Your GI or your digestive tract, guys, mucosal bleeding po. Opo. Kasi nga, guys, your entire GI tract is lined with a mucous membrane, guys. In a healthy person, tiny tears in the mucosal lining are sealed by your von Willebrand factor and platelets. Therefore, pag merong von Willebrand disease, guys, minor irritations, guys, automatic internal bleeding, and it may result in anemia and changes in stool appearance. And yeah, iron deficiency anemia, guys, opo, if blood loss na talaga. It may be manifested by these kinds of things, guys. Your fatigue, shortness of breath, and pale skin. Okay? Your reproductive, this is especially for women, guys. Menorrhagia. Pag ang menorrhagia for patients with von Willebrand disease, yung bleeding nila, yung menstruation nila, tatagal ng more than 7 to 8 days and passing large clots. Opo. And your postpartum hemorrhage, your normal physiology during pregnancy, body naturally increases von Willebrand factor and factor VIII to prepare for childbirth. Pero ang problem dito, guys, after delivery, bababa agad. Opo. Therefore, high risk siya ng postpartum hemorrhage. Okay? Ovulation bleeding, normal physiology, release of an egg from the ovary, causes a tiny rupture in the follicle. Therefore, yeah. In patients with von Willebrand disease, peritoneal bleeding, sharp, intense pelvic pain mistaken for appendicitis. Okay, and your musculoskeletal, your hemarthrosis, and your hematomas. Okay, so that would be very much it, guys, for the von Willebrand disease. And I am doing po this hemophilia. Opo, I'm doing this. Opo, this is my second installment from the Coagulation Disorder Series Part 1. So I will do a note, or I will do some notes of it, guys, and I will do it in the form of a video. Opo, like this, von Willebrand disease. So guys, thank you so much for listening, and hope you've learned something. Kasi naka-learn din ako. So guys, again, this is Joseph, a licensed teacher by profession and a student nurse, and yeah. Bye-bye.